Good evening, everybody, and welcome. I'm Ariel Khalil. I'm the Daniel Levin Professor here at the Harris School of Public Policy. And I'm absolutely delighted to be with you here tonight as we honor the work of Pulitzer Prize-winning science journalist at The Atlantic, Ed Yong, our 2022 recipient of the Benton Award for Distinguished Public Service. Let me just tell you a little bit about the award. The Benton Award is a University of Chicago tradition created to honor Senator William H. Benton on the occasion of his 25th anniversary as chairman and publisher of the Encyclopedia Britannica. This award recognizes people who have rendered distinguished public service in the field of education, including, and very importantly, accomplishment in communicating and disseminating knowledge to the general public. Previous recipients of the award have included Katharine Graham, graduated with her AB in 1938, and Martin Barron of the Washington Post, Judge and former White House Chief of Staff Abner Mikva, and Senator Paul Simon of Illinois. I had the great pleasure of serving as the chairperson of this year's Benton Award Selection Committee. I worked with a wonderful and exceptional group of scholars from across the university, and 3 of the 4 of them are here tonight, and I would just like to take a moment to recognize them and thank them for their time and dedication and the fun we had in choosing such a wonderful nominee. So Emily Buss is here. Emily is the Mark and Barbara Freed Professor of Law at the University of Chicago Law School. Liz Clemens is also here. William Rainey Harper, Distinguished Service Professor of Sociology in the college. And Bob Gertner, the Joel F. Gamunder Professor of Strategy and Finance. And John Edwardson, Faculty Director of the Rostandi Center for Social Sector Innovation at the Booth School. Harold Pollack from the Crown School, the Helen Ross Professor at the Crown School, is also on our committee. He is not here at the moment, but he will be joining Ed for some of tomorrow's events. So thank you again to all who served with me on this exciting enterprise. Let me just say that this committee received many nominations for this year's award, each nominated by our colleagues from across the university. The candidates all demonstrated a personal commitment and substantial contribution to a systematic and distinguished way of shaping minds and disseminating knowledge. But what stood out to us about Ed was his delivery of extraordinarily high-quality science writing during a time of national, indeed international, crisis. His ability to translate complex science to the public and the rigor, judiciousness, and humility with which he pursued this effort make him an extremely deserving choice for this year's award. Ed was nominated for this award by our colleague, University of Chicago sociology scholar Joyce Bell. And please help me welcome Joyce to the stage to tell you a little more about our honoree, Ed Yong. Thank you.
Thank you. So today, Ed Yong will be receiving the Benton Award for Distinguished Public Service in recognition of his clear-eyed, evidence-based reporting and public service through education during the COVID-19 pandemic. The fact that Yong translates complex science into writing that non-specialists can read and understand is clear. He's been doing that for some time, has won numerous awards. In fact, he was awarded the Pulitzer Prize in explanatory reporting for a series of lucid, definitive pieces on the COVID-19 pandemic that anticipated the course of the disease, synthesized the complex challenges the country faced, illuminated the U.S. government's failures, and provided clear and accessible context for the scientific and human challenges it posed. All of that is true. And beyond that, Yong's writing is brilliant, the kind of writing that most of us can only aspire to. If you want proof, you can check out his New York Times best-selling book, I Contain Multitudes, a book about microbes that William Gibson called wonderful, deeply strange, true, funny, and beautifully written. Imagine that. But my reason for nominating Ed for this award is not purely academic. I came across his work in the early phases of the pandemic, the wiping down groceries with bleach phase, when many of us were whipped into a frenzy by the media and then went on feeding our collective panic by consuming this end-of-the-world variety of news stories by the dozen daily. Then, on March 25th, I read Ed's piece in The Atlantic titled, "How the Pandemic Will End." The tagline, "The U.S. may end up with the worst COVID-19 outbreak in the industrialized world. This is how it's going to play out." In it, he spelled out how we had arrived at that dark place, how we could have been better prepared, what could be done, and what science had to tell us about potential outcomes. The writing was sharp and smart, it was critical of the country's response, and it was honest about the seriousness of the situation at hand. But I still found it calming. I started to seek out Yong's writing on the pandemic because his was the only voice that I could find that was informative and realistic without feeding the frenetic energy caused by the constant barrage of news about the pandemic. And that's really it. I thought, if this person can calm me down while I'm trying to decide if I had gotten bleach on the grapes, then I can't be the only one. Then he is someone who truly embodies the spirit of the Benton Award, doing public service through education. I wrote to Ed just as a reader and a fan sometime in 2020, thanking him for his writing. And I wrote to him in deep gratitude because as an anxious academic, I wanted to be informed, but I couldn't keep consuming news that sold a narrative about the falling sky. So this nomination for me was an extension of that gratitude and recognition for his contribution to our collective calm and comprehension. We're all better, Ed, because you are in the world with us during these trying times. With your talent and light, you could be anything. That you choose to be of service is a gift to us all. Thank you. Now, it's my pleasure to introduce Dean Catherine Baker. Catherine Baker has served as the Dean of the University of Chicago Harris School of Public Policy since 2017. She is a leading scholar of health economics whose research has been widely published and has played prominently in debates about reform of the U.S. healthcare system. She serves on the Congressional Budget Office's panel of health advisors and has been a commissioner on the Medicare Payment Advisory Commission and a Senate-confirmed member of the President's Council of Economic Advisors. So please join me in welcoming Dean Baker.
And with those wonderful introductions, I would like to present the actual award to Ed. So Ed, please come join me. And isn't it pretty? Thank you. Congratulations.
Thank you so much.
And please have a seat. And I would love to ask you some questions. That's right. He thought the award was free, but no, we have lots of questions, and I have a long list of questions that I would love to ask Ed, but I also want to be sure there's time for the audience to ask questions, so be sure to have your questions ready, and I will turn to you shortly to engage you in the conversation as well. So we heard a wonderful introduction about how important it was to people to have information about COVID in real time as the pandemic was unfolding, and how challenging it was to find information that was not playing on people's fears to generate more excitement around a web page, that was not stoking fears unreasonably, but also wasn't sugarcoating the reality of what was a truly catastrophic pandemic. It's increasingly challenging to get that kind of information in the world. And so how do you navigate, as somebody aiming to be a voice that translates evidence faithfully to readership, a world that is increasingly pushing news outlets towards polarization and where people are increasingly getting their news from sources that reinforce their pre-existing views?
So we're starting with a nice, easy softball question, I see. Well, firstly, thank you all for this amazing thing and those beautiful introductions. The face mask makes it harder to tell when I'm ugly crying, among its many benefits. So there's a lot of different ways of answering that question. I think that a lot of my writing about the pandemic has made this argument that our failures are primarily institutional and systemic more than they are personal and individual. And I think the same must apply to our successes. So in part, I got to do the work that I did because I had the right environment that allowed me the time and the space to do long pieces. So I wasn't being pushed to deliver small, 800-word news bites to fast deadlines. And I think that incentive structure, as you've noted, is problematic for my entire profession. Our tendency in journalism is to be quite fragmentary. So we take a big story and we carve small pieces of it and show them to our readers one at a time. And if the story is itself small, that's fine. Sometimes a piece is just a piece, and that's okay. But with something like a pandemic, something that touches all of us, that upends all of our society, that is by definition global in its scope and its stakes, that approach just doesn't work. You end up with a lot of pieces and no sense of what they all mean. What I've tried to do in my work is to focus on that sense-making aspect of it. So not just telling people what is happening, but helping them derive meaning from it. And that is a very different task. It requires space. So most of the pieces that I wrote about the pandemic have been, I think my editor and I joke that 2,500 words is a short piece. They've been as long as 8,000, I think. Most of these pieces I'm talking to up at least a dozen people, if not up to 40, I think was the largest. They really are attempts to not just feed people bits of news one at a time, but to say, we are here. Like to show people the entire map from 30,000 feet and to say, like, here is how all of it fits together. Here is where we are. Here are all the things that led us to this point. Here are all the places we could go in the future. And I think that the piece that Joyce references from March of 2020, How the Pandemic Will End, that really set the tone for all of the rest of it. That piece in its conception and execution and the response to it showed me that there was a different style of journalism that we needed right now and that people were responding to. By far the most common, I got 1,000 emails in response to that piece within a matter of like a week or so after it came out. And one of the most common pieces of feedback was exactly what Joyce said, that I get it now. And I think that completely changed my understanding of what kind of journalism was necessary to meet the demands of this moment, but also like what journalism was capable of, what it could accomplish.
You've highlighted in your pieces and in your answer right now the failures of public policy more than individuals in getting us to that complex landscape that you were able to convey so powerfully. We're a school of public policy. We're a community of scholars and leaders who care very much about getting the policy right, and this seems like a striking instance of the real harms of getting the policy wrong. What do you wish we had done differently in terms of public policy?
Oof.
That's another soft one.
How long do it right?
Maybe just 10 or 20 words should do that. Yeah.
Totally, you're right. Everything? No, that's not fair. So I guess I'll say a couple of things to this. I've written a lot about how America's very strong bent towards individualism hurts us and harms us and stops us from putting in the kind of actions that are required. It harms us on a lot of different fronts, right? Like one of the most pernicious myths about the pandemic, I think, is that our failures are the result of a lot of people individually doing the wrong thing. I think the failures, as you said, are large scale. They're to do with policy. But a lot of our policy, especially like, you know, I've been writing about this especially over the last year and a half or so, but a lot of our policy is geared towards individual action. Right? It's, and especially at the moment when vaccines became available, it really felt like the public health dimension of this started eroding, and it really became this very individualistic free-for-all. That was echoed in rhetoric from the highest echelons of leadership, from the CDC director, from the president. A rhetoric like, your health is in your hands. I think a lot of people here who work in public policy and public health recognize that your health is never entirely in your hands because, firstly, it's an infectious disease, so they spread. So my health is profoundly influenced by the actions of my neighbors. But also, a person's circumstances always constrains their choices. And so the decisions that you are able to make to protect yourself and your loved ones are also influenced by how much time you have, what kind of job you have. All of this is to say that pandemics are fundamentally collective problems. They cannot be fought on an individual basis, and they cannot be fought through policy that prioritizes individual action above all else. It's why public health, I think, is so important. Right? It's you're taking actions to prevent sickness at a community level across entire populations. I also think that I've been writing a lot about some of the processes that lead us to normalize everything that has happened. On September 18th, Joe Biden said that the pandemic was over. Since he said that, just shy of 17,000 Americans have died of COVID, which is a very interesting definition of over. I would argue that this tendency over the last year and a half from leaders, from many influential voices in my profession, in the media, from people all over the country to repeatedly declare the pandemic over when it wasn't, is a reflection of the fact that we rely far too heavily on technological solutions to this kind of problem. Technological solutions tend to flow most readily and most quickly to people with resources, connections, money, knowledge, power. Those people then move on with little care of the gross inequities that are left behind and the people who have to shoulder the brunt of the risk that remains. Immunocompromised people, people with long COVID, people from minorities who've been disproportionately killed by COVID. This pattern, it's reflected in the theory of fundamental causes. It's why I think we continue living in this state of perpetual vulnerability. It's why America was vulnerable to H1N1. It's why it's vulnerable to COVID when it's arrived. It's why it hasn't handled monkeypox very well. It's why it will probably not handle the next thing very well. It's why we've kept on making the same mistakes for every new variant that's come along. I think we seem either unwilling or incapable of learning the real lesson of this, which is that we have a lot of baseline vulnerabilities, and those need to be addressed to be better at this entire class of problem. This isn't just a thing that we're going to tech our way out of.
So there's so many threads in there that I want to pick up on. I'm definitely going to come back to the question of disparities in access to care and impact of COVID. And I want to come back to communication from officials about best practices and messages to the public. But I also want to follow up on the thread about what it is we should do differently based on what we learned from COVID for the next thing, whether the next thing is monkeypox or something else. If you got to decide, if the award came with a magic wand and you could change our policy, I always hate the magic wand questions, I'm sorry. But if you got to decide a couple of things that we would implement at a federal or state level that would make us better prepared for the next pandemic, or that would be the way we should spring into action when the next pandemic arrives, what would a couple of those things be?
Okay, so a lot of people have talked about the importance of better ventilation, and I think that remains crucial. Right? I think the early debates about the aerosol nature of the spread of the new coronavirus brought this to people's notice. But I think while that has been more firmly accepted, the actual impact on public policy just hasn't been there. Like we could do more to make sure that we're all breathing cleaner air. So I wrote a piece in the middle of this year about what we could do if the kinds of policies that public health experts have been calling for many years now seem to not be materializing. Like what should we do? And a lot of that piece is about the importance of community work. It's about the importance of grassroots action. Like if we're not going to expect the kinds of policies that will save us from the top down, then we need to build something better from the other direction. A lot of people have talked to me about the importance of community health workers, for example, like a kind of infrastructure of care that actually meets the basic needs of the population, and especially those who are most vulnerable. And I think when I talk about this, I usually find that there's two kinds of reactions, right? There's either people who just get it immediately because they sort of work in that space, or there's people who are like, really? Like, that's your solution to like a pandemic? That's a big global thing. We need vaccines and drugs. You want basically like a lot of very intense community-based social work? Like, but yes, that is actually very much what I want. Like, I think that the frayed social safety nets of this country create this bedrock of vulnerability that means that people really struggle to take care of themselves. They really struggle to take care of themselves in the middle of a crisis, and they are often forced to choose between their lives and their livelihoods. And because social safety nets have been allowed to fray horrendously over the last several decades, it creates this horrible situation now where people have to work in really unsafe conditions, and it allows for the wider and faster spread of infection. And it means that healthcare workers, as they've been so commonly described throughout the pandemic, become frontline workers. Like, hospitals are not meant to act as the front lines, right? Like, if that is the case, they will get overwhelmed, as we've seen. Like, we need an entire infrastructure of care that stops people from getting sick at a community level, and that looks after their health before they get sick enough to visit an ER. I think that kind of infrastructure is possible. It exists more in a lot of other countries. America has the foundation for that, but I think there needs to be a lot more emphasis on that. And I think I could go on a lot. I think just to sort of put an umbrella on this like category of solutions, when I wrote a piece in 2018 about whether America was prepared for a pandemic or not, a lot of that piece, I think, holds up, but it is very, very biomedical in its focus. It is about our infrastructure of creating new vaccines. It is about genetic surveillance for new pathogens. Most of my pandemic reporting has drawn heavily from the social sciences and recognizes that pandemics are not just a health problem, they're a social problem. They rely on things like trust, people's ability to just meet their basic needs. And if we don't think about those things, if we don't think about the spread of misinformation, if we don't think about the social inequities that have made the pandemic so much worse, we will continue to fail at this. We may well get into a position where we can create new vaccines and drugs very, very quickly, but it still won't be quick enough, and we'll still end up with the same kinds of problems that we've experienced over the last year and a half, when actually the biomedical countermeasures are really great, but everything else is still weak and frail.
So there are so many important implications of what you've discussed for the amplification of disparities in exposure to diseases, especially COVID, in the ability to get care conditional on getting COVID, on the economic consequences, and all of that amplifies underlying health disparities that are stark in many places in the US. They're particularly stark here in Chicago, where we have this shocking gradation in life expectancy across the city, that really highlights those disparities in underlying social determinants of health and access to health care. And something you mentioned as an amplifier, I think, is the lack of trusted relationships, for good reason, to translate information to actionable mechanisms for people in different communities. And the way we talk about the pandemic and actions that are available to people, and the way we generate resources for people to act on recommendations is clearly wildly disparate, as you've highlighted. How can we, or do you have any ideas for strategies that would let us more effectively communicate best practices to different audiences with trusted voices, especially given that the science is evolving? Like you talked at the beginning about how we were all wiping down our groceries because nobody knew. And masks are bad, masks are good, masks are really good. Don't wear a mask anymore. There's the science evolved, and that further muddied the message. So I think we've lost a lot of faith in voices we used to rely on. That was a very sprawling and compound question. What I'm really asking is, how do we get better information to people in a way that helps reduce the disparities that the pandemic laid bare?
Yeah. I think this is a tough question for me. I often find this a tough question to answer because I work in a mainstream publication. I think that actually the hard work that needs to happen occurs at a much more intimate, more personal, high-touch level. It's people who are not me working at community-based events, talking to people who share the same life experiences. That's why I talked about the importance of community health workers, right? Like that's the sort of thing that has, I think, shifted vaccination acceptance rates up from the point when they started first stagnating. But I also do think that platforms like what I have, which have much larger audiences, do still have a really important role. And I think the pandemic made me realize that I've been thinking about this in slightly the wrong way. I think a lot of people think about the media as a one-step process. So I publish something, the Atlantic's readers read it, and that's it. And then the obvious question is, how do you're only reaching this, frankly, quite very privileged group of people. And you are writing about these very intense disparities. Are you actually talking to the people you need to be talking to? But one of the most common themes from the feedback that I've got from my pandemic work has been people using the pieces to have conversations with other people. So it's your piece allowed me to talk to my conservative Fox News watching relative about the importance of masking. Your piece on long COVID allowed me to talk to my employer or my doctor or my friends and family about the symptoms that I'm going through. It's that kind of thing. It's a two-step process. And I think when you start factoring that in, much like the spread of infectious disease, the influence of the work grows exponentially. And that piece of it is something that I think is very hard to put a finger on, because I don't know about it unless people actually tell me about it. But I think it is actually the most profound and most important use case of these pieces. It's not just someone reads them and it changes their mind, but although that can happen and is super important too, but it also allows them to become networks, like a node point in their own social network of reasonable information, of solid, actionable stuff. So it's the fact that this work can ripple across the entire network that I think is really important. For that to happen, though, it has to be of service, right? So that goes back to the answer to the first question. The work isn't going to do that if it's just a kind of clickbaity, bite-sized, here is another angle I thought about the pandemic. It really has to help people. There's really been two categories of pandemic pieces that I've done. One is the type that Joyce referenced, which is a big picture, trying to make sense of everything piece. And then the other is trying to bear witness to the experiences of people who have suffered the most in COVID, people who are grieving loved ones, long haulers, healthcare workers. Right? And both of these categories are intended to be acts of service. They're intended to either help people make sense of a crisis or to give testament to some of the costs of that crisis. And I think those are then the types of pieces that people will want to share and spread through their networks. Pieces that can open up important discussions and conversations that didn't already exist. And
you've reminded us, as if we should need reminding, that COVID is not over. Hundreds of people are dying daily, and that we've grown inured in some ways to numbers that ought to be shocking every day. And another card that hasn't yet been turned over is the effect of long COVID, and we don't know really what the prevalence is, and we have no idea what the long-term health consequences are because we're not in the long term yet. And we can think about that from the perspective of the healthcare that's going to be needed, but more importantly, the effect on people's lifetimes of health and well-being. What do you think the consequences of that are going to be for the population and for the healthcare system, if I can push a little bit?
I think they're just going to be immense, and and I don't think that societally we have even really started to grapple with how significant it's going to be. My journalism, my profession deals with the news, right? We are a profession of the present moment. And I think that can be a problem. Many of us have spent the last 3 years staring at these graphs of case rates doing that, right? And journalists focus on where we are here, what are hospitalizations and deaths and all the other metrics now. But there comes a point when that is no longer the story. The story is all of that. It's the cumulative weight of everything that happened before weighing down upon us right now. So long COVID is a great and very tragic example of this. I have spoken to people who got sick at the start of the pandemic in spring of 2020 and are still sick. And one of the, aside from all the physical symptoms, one of the most important comorbidities of long COVID is being ignored, having your symptoms doubted, trivialized. If it's not, oh, you just have anxiety, it might be a bigger scale. Long COVID is real and serious, but not actually that common, not actually that important. There's downplaying at every turn of individual experiences and of the scope of the societal problem. And I find this very difficult to think about, because I've done a lot of work in this space. I don't think our policy choices would be the way they are if we really truly took into account what this meant, like the actual long-term cost of infection. It is not reflected in any of the metrics or any of the data that is commonly collected. The experiences of long COVID that people are going through are incredibly similar to the experiences of people with conditions like ME, dysautonomia, fibromyalgia, and a lot of other complex chronic illnesses have gone through well before COVID. All of those pieces, all people with all of those conditions saw long COVID coming, like knew that a wave of disability was on the horizon well before most of the academics and clinicians that I talk to and deeply respect realized what was happening. But they too have been neglected and dismissed and disbelieved for the longest time. And I think if that wasn't the case, we would be in a much stronger position to know what to do about long COVID now, rather than having to play catch up at this frenetic pace while fighting against all of the same social dismissal that people with those other conditions have dealt with for the longest time. I think that the sort of going off what I said earlier about how this is all fundamentally a social problem as much as it is a biomedical one, the social stigma adds and exacerbates the cost of long COVID well beyond the physical symptoms. It means that a lot of people are not only suffering, but also suffering without due care or compassion, in silence. And that contributes to the feeling that some people have said that I don't actually know that many people who have long COVID. Like, if you don't know people who have long COVID, it's probably because they don't feel able to tell you that they're going through these symptoms. Like, I have reported this since day one, and I only found out in the last month that 2 of my friends have long COVID. Right? There is a sort of gross repression of it all that I think is part of the problem. Right? So that's one long-term consequence. We also talked about. You also asked about the healthcare system, right? I've also written several pieces about this, and it continues to be immensely frustrating to me that I think people aren't kind of getting it, because there is still the sense that the metric of how badly the healthcare system is being hit is hospitalization rates in the current moment. And it's not just that, right? Like, I've written a lot of pieces about healthcare workers who, for a multitude of reasons, because of the traumas they've seen, the moral injury they've endured, the just catastrophic levels of burnout, the relentless surges of COVID followed up by surges of catch-up care for all the stuff that was deferred during the surges of COVID, it's just been nonstop. And it's meant that a lot of people have dropped out of the profession that was already suffering from high rates of burnout and a shortage of nurses and several other key workers before COVID happened. All of that just gets worse and worse as the pandemic goes on, as every new surge brings a new set of assaults onto the healthcare system. And it's not just that there are fewer people, it's also that a lot of veteran healthcare workers have left, so there is now a dearth of knowledge and experience. It's that the people who are staying behind and who are trying their best are more burned out with every passing month. And I think we saw this most clearly during the first big Omicron surge, but it still continues to be a problem now, that I'm just not sure people understand that the quality of healthcare that they might receive now is not what it was. It's not what it was in 2019, and that if we keep pretending that this is all over and keep letting infections run amok and keep forcing the healthcare system to act as the front line, to hold the line when everyone else is refusing to, then that system is going to erode even further than it currently is. And I'm really worried about that. I mean, my concerns now are not just about COVID and about long COVID. They're also about what happens if I just get sick, full stop.
I could ask hundreds of follow-up questions if I were not cowering under the covers now. But I would like to make sure that our audience has a chance to ask questions. And there's some mics, and I see some hands. So please raise your hand. We'll get you a mic. And I see 1, 2, and we'll go from there.
Is it mine? Can you guys hear me?
Yes.
Great. Hi, Ed. It's so great to meet you for a million different reasons. My name is Ibrahim Rashid. I'm a alumni from Harris, but most importantly, I'm a COVID long hauler. Long COVID wrecked my time at grad school. I graduated miraculously. Heart issues, brain fog, body aches, difficulty walking. I was in a wheelchair and a cane for quite some time. Your writing makes many long haulers feel less alone. I just want to start with that. You know, during my time in grad school, spoke with elected officials, spoke with many people. I've had many times panels here at UChicago on disability where I talked about long COVID, and I would always share your writing whenever I would speak with elected officials, congressional advocates. I'm also building a tech startup to help people with long COVID predict their symptoms. I was at the UNGA, presented alongside Chelsea Clinton, my startup, and a congressman came up to me and he was like, hey, I have long COVID. And I was like, you should read Ed Yong's writing, you know? And trying to be the patient advocate is one of the hardest things I've ever had to do. And your article, COVID long haulers are fighting for their lives, is exactly how I feel. It has been one of the hardest things I've ever had to do. And I felt very depressed and alone, but discovering your writing helps me see myself within a larger movement. And because of that, I feel less alone, and I'm able to do the work that I'm doing for COVID long haulers. I don't think many people here realize just how important you are for those of us in the disability community. Shit, I want to cry as I'm saying this. But I just want to say thank you from like the bottom of my heart for what you have done for us COVID long haulers. Without you, our voices would not go that far, you know? So I just want to say thank you. Yeah. That's my comment. We have to ask a question. You know, you're addressing a room of policy professionals, it's live streamed and so on. Tell us, what is long COVID? I can talk about it. I've spoken about it here at UChicago. People don't listen to me. You have an audience. What is long COVID? What is the scope of it? And in a room of policy professionals, what are the things that people here who will someday run for elected office, be involved in policy implementation, what should they be thinking about during their time here at UChicago so that COVID long haulers like myself, like the many that you have interviewed, aren't left behind? Just help us as policy people think through what are the interventions that need to be made at the margins to make sure that we're not left behind. Thank you.
Thank you. Let me get to the question first, and then I've got a thought about the comment that preceded it. All right. So I think most people are familiar with COVID as an acute disease. You get sick, you get infected, you get sick. Hopefully, you recover. But it doesn't have to be that way. There is a vast hinterland between recovery and death. And in that space are people with long COVID, persistent symptoms of the condition that continue for months, sometimes years, and that can be erratic, that can come and go. It could be like having a grab bag of symptoms every month, a new thing. Some of the most common ones include brain fog, a term that in no way really captures how serious that condition actually is. Brain fog is a deficit of executive function, which means that it hits abilities like concentration, focusing your attention, blocking out distractors, and keeping information in mind. And if it sounds like those are the foundations for almost every important thing we do, that's because it is. So people with brain fog often struggle to drive, read. Things like unloading a dishwasher can be absurdly complicated and undoable. Also common as a symptom is post-exertional malaise, which is not the same as fatigue. It means that after even mild physical or mental exertion, you can go through severe physiological crashes where all your symptoms get worse. This is a huge problem because many people with long COVID are told that they can exercise or push their way out to better health. And if they have post-exertional malaise, they very much cannot, and it may in fact make things much, much worse. Those are two of the most important symptoms, and I highlight them because they are often the most frequently misunderstood. But there are so many others. Even among just thinking about the friends that I have who have long COVID, their symptoms include debilitating vertigo. A relative of mine had a fever for, I think, 6 months straight. There are a lot, but what this means is that for a lot of people with this condition, their quality of life is significantly reduced. Their ability to go do the normal daily tasks that everyone else takes for granted is severely reduced. A lot of people can't work. In the most severe cases, people can't function. They're bedbound, they're homebound. This is a huge issue. It's a huge disability rights issue. And there's a lot of things that need to happen to make life better for people with long COVID. First and foremost, we need to prevent people from getting infected. That is probably the most important thing. The current posture where we only care when hospitalizations spike, and we only treat this as a problem if people get severely, quote unquote, ill, which means hooked up to a ventilator, is unacceptable, because the cost of that is a lot of people are going to get infected, and some of those people are going to get long COVID. Vaccines do seem to reduce the risk of this, but they are not perfect. And certainly I know people who have been vaccinated and gone on to develop long COVID after an infection. So prevention matters. For people who have it, help with all of the indignities of getting care when disabled. So a lot of people can't work, and if you can't work, it is really, really hard to get onto disability, and especially if you have brain fog, a symptom that stops you from dealing with things like forms. So social supports for people with these kinds of conditions are really important. Compassion and understanding is crucial. One of the most common comorbidities of long COVID is social dismissal. We talked a bit about this already. People are regularly gaslit and told that they don't have a problem, that they're not sick, that it's just anxiety or depression, that they'll just have to push their way out of it. Again, all things that people with other complex chronic illnesses go through and have heard for a long time. A lot of this also comes from the medical profession, the people that these folks go to for care and support. And there's a lot of things to do, but I do just want everyone to imagine the indignity of living in a world where you are told that it's on you, it's up to you as an individual now to whether you get infected or not. If you do get infected and you don't get better, you will struggle to find anyone who believes you. That is the bargain that we have all been offered, and I think that it is unacceptable. I hope that I could go on for hours. One thing I did want to say, Ibrahim, is it? Yeah. you've been very kind about my work and the influence it's had and its ability to help your community. That means the world, because I think that years from now, when all this is hopefully a memory, the impact of the long COVID reporting I will still hold very dear to my heart. I do think that it should not just be on the disability community to advocate for themselves. I think it also comes down to, the burden should be on people like me. I do not have a disability, I do not have long COVID, to tell those stories. But that said, I tell those stories because people in your community spoke up for yourselves. I know about this entire class of problems because a dear friend of mine named Sarah Ramey wrote a book called The Lady's Handbook for Her Mysterious Illness. And I read an early copy of that before the pandemic hit. And I don't think I would have really understood what any of what I was hearing meant without first reading that book. An account of Sarah's own experience with ME/CFS and chronic pain, among other things. In the early pandemic, Mara Gay and Fiona Lowenstein wrote about their experiences with long COVID in the New York Times. Felicity Callard wrote an amazing piece in the Somatosphere blog about what mild might actually mean. A lot of long haulers talked about their own symptoms and their own experiences. And I would argue that all I did was to listen to them and to talk to more of them with an open mind and heart. But I know it's hard as a patient advocate. It shouldn't be on the people who have the least amount of energy to fight relentlessly against the current for your own basic rights. But I will say that because you all did that, I had something to work from. So thank you.
Thank you very much for that question and for that answer. And you have time for a couple of more questions. And I see there's a mic in the back, and then we can come down to the front again after that.
Hi. Hi, I'm Lena. That was very powerful. So I'm a second year MPP, a jack of all trades, very interested in everything. And I'm a Chinese American. In undergrad, I majored in journalism and public policy. I got into journalism for a little while. I kind of crashed really bad mentally. I became a completely different person. I lost touch of myself and had to take a year off. And that's when I decided I needed to go to grad school. And honestly, being here kind of turned my life around. I've covered trauma, not to the extent that you have. I worked in local news I don't really know what it's like in the international news field. I worked in local news. I was the one single beat reporter for a small city and 2 towns, and it was really hard. I covered death, suicide, COVID, the PFAS water crisis that is still ongoing and horrible in this country. And, one thing that I struggled with consistently when it came to journalism was the feeling of rejection. I even felt rejected by my own community of Asian American journalists. I didn't really feel like I fit into anywhere, and it was hard because I was also struggling with anxiety, depression, PTSD, and all this trauma. And what I'm asking is, how do you navigate that as an Asian journalist? Especially someone who also, dives into academia at the same time.
I hear you and I feel you. And the answer is honestly with some difficulty. I came into journalism through a kind of sideways route, and I think that I spent most of my time in this field not really feeling like I fit into it. And I still honestly feel that in many ways. I feel like the work that I want to do and the values that I want to bring to it are often not gelling with where the profession is right now. And it's hard. And I think the work itself, if you take it seriously, is really hard for all the reasons you described. Like, I think at its best, we, like all the usual catchphrases, right? We speak truth to power. We comfort the afflicted. No. Yes, we comfort the afflicted and inflict the comfortable. We bear witness to suffering. All of that is hard, and it takes a toll. And there are few resources or institutional support or community support in the profession for people going through that. I don't know if you know this, but so I'm currently on just past the first month of a 6-month sabbatical. I've stepped away from my job for that time, precisely because I am burned out beyond the telling of it, because covering COVID has been it's been absolutely shredding for my mental health. But I will say that when I talk to other people who are also burnt out, healthcare workers, other journalists, there seem to be 3 categories of solutions that they take to try and fix it. One is to double down on a sense of mission and duty. Another is to find strength in community, to find other people going through the same thing, and to use and to rely on your friends and colleagues for support when you don't have the strength in that moment. And the third is to step away, either permanently or temporarily. And I will say that I have done the first for as long as I can, and I'm now doing the third, so hopefully I have time to focus on the second. But that's sort of it, and this possibly isn't the most helpful or optimistic answer, but I do think that I will say that journalism is tough, right? It's what is unhelpful is when people tell you, and maybe you've heard this before, that if you find it tough, if you are struggling in the way that you've described, then you're not meant for this profession, that you don't have what it takes to be a journalist. Well, I'm finding it tough. So the next time someone tells you that, I'll ask them to tell me to my face that I'm not meant to be a journalist. I think that we often talk about, the qualities that get valorized in my field are very stereotypically male. They're very antagonism, toughness, a kind of brusque arrogance. Well, what we need are traits like curiosity, empathy, compassion. And I think if you have those, you cannot report on the beats that we've been reporting on without taking some kind of hit for it. It is only natural to do that, and it is only natural to take the steps that you need to take care of yourself. I hope that helps.
Thank you, and I think we have time for one last question.
Hi, I'm Harold Pollack. I'm a public health researcher here with primary appointment at the Crown School. I want to ask a question about public policy and the fiscal structures of American healthcare. I mean, one of the things that's so horrifying about COVID is the way that it exemplifies how public health is really boring until it's not, and then it gets boring again. And we have this $4 trillion healthcare colossus that can't somehow support healthcare clinics, the basic rudiments of public health, which are just dramatically underfunded. And I wonder how you would change the fiscal structures of our health policy governance so that when the next COVID comes along, which won't exactly resemble COVID, it will be whatever the next thing is, that we have some infrastructure that we actually have nurtured so that we are prepared. I mean, you're describing these community health workers and so on. If I'm the state of Illinois, I can provide huge amounts of money to the university, to billion-dollar buildings on this campus to provide personal health care. If I want to hire more case-finding community health workers, the federal government does not provide a matching fund or anything like that, and I have a huge incentive to neglect public health. And I wonder how you would change that.
Yeah, right. And I think the problem is it's that, and it's also that because we don't have that infrastructure in place, it's really difficult to put that infrastructure in place. Like, I think that a lot of people I've talked to who thought about this exact problem have noted that, like, in the early pandemic, you had a lot of like volunteer support, right? You had a lot of people coming in and wanting to do this kind of work, but then there's no structure in place to like hire those people or to actually turn all of that enthusiasm and grassroots like energy into something that's actually permanent and concrete. You know, there's no mechanism for even building the thing that you're talking about. I think beyond that, I do find this question a little bit challenging to answer, in part because, as you can tell from the accent, I am not from around these parts. And I'm still coming at this from a very visceral reaction of, you'll pay for healthcare? That's a wild and interesting choice. So I don't know is the answer. I'm sorry I don't have a better one. I genuinely don't know, but like I think your description of the public health problem is a thing that is weighing on my mind quite heavily and that I don't have the solution to. Like the fact that it is important when it's too late to do anything about it and then feels unimportant when the crisis resolves. I don't know how to fix that. But one of the things I noted in the piece that I described about, which really was me like putting myself through journalistic therapy of like, I don't know what to do about this. Let's just try and talk to a bunch of people and report it out. The only thread of hope that I found along those lines was, again, that there has been a long history in this country of community groups who've taken action to protect their own people at a time when broad-scale policy was failing them. And that includes everyone from the Black Panthers to the Young Lords to ACT UP, most famously. And I see the equivalent of those groups now rising up, finding strength, knitting together, which is great. And I find some hope in that. This in no way answers your very specific question about fiscal policy, which I'm ill-equipped to answer. And one of the things I do think is really important with the pandemic is to not hold forth on things you actually don't know about. Would be nice if more people did that. But I hope that goes some way towards getting at the types of things you're asking about.
Well, your answers have been so thoughtful and so illuminating, and despite the challenges that you've highlighted, I know that I feel better about our prospects of advancing better policy and better responses to real human needs because of the work that you do and what you've highlighted for us today. So thank you so much for all of your work and for being here, and to the committee that so wisely brought him to us. Please join me in thanking our Benton recipient, Ed Yong.